Distinguished guests, ladies and gentlemen, welcome to join us at the webinar of Taiwan and Indonesia Smart Medical Innovation. My name is Cheng, your host for today's event. Today's event is jointly organized by TAITRA, Taiwan's foremost trade promotion organization and Bureau of Foreign Trade. Taiwan provides high-quality medical services and advanced technology. Many international patients have been drawn to Taiwan for cancer treatment, treatments for cardiovascular diseases, robotic surgery, liver transplantation, artificial reproduction, joint replacement, craniofacial reconstruction, and so on. Advanced medical services are our core competence, which combine the strength of Taiwan's ICT industry, bring together various researchers from biotech, healthcare, and high-tech sectors. In order to enhance healthcare industry cooperation between Taiwan and Indonesia, TAITRA has set a goal to organize a series of seminars. Taiwan's national health insurance system has been praised by many international media outlets as one of the best in the world. For the last several decades, it has built up a comprehensive yet in-depth health database, becoming Taiwan's major advantage in the big data research for smart healthcare. Before we start today's sessions, let's look at this sharing by Dr. Chang Li, the Director General of the National Health Insurance Administration in Taiwan.
Good afternoon. I am Dr. Chang Li, Director General of National Health Insurance Administration in Taiwan. We are very appreciative the IDC offer us this credit. We know Taiwan NHIA is just a single payer system, so we try to offer the best medical care to all Taiwan people. So the strategy is very important. In the past, we used ADSL to let the doctors to claim their medical information. But recently, we used we call the fiber system. So we also built we call the MediCloud system to let all medical information can be shared between the hospital and the clinic. So in this time, during this time, I think the COVID-19 come here, we try to stop the spread of COVID-19. So in that way, we offer the medical information we call the TOCC record to all the medical providers in here. TOCC means the travel, occupation, contact, and cluster. So this is very important for us. And another thing is that we know mask is very important this time for us to control the spread of infection. So we also wish the 6,000 drugstore they can let the people purchase their mask through the name-based system. So the IT system this time is very successful in Taiwan. Thank you very much.
Thank you, Dr. Li, for this wonderful sharing. Moving on to the presentations, we have two sessions today, Smart Medical and Smart Healthcare. The first speaker is Dr. Pan Jiande, the Executive Secretary of the International Medical Service Center from National Taiwan University Hospital, Yunlin branch. Today, he will share with us about telemedicine service in countryside. Let us welcome Dr. Pan.
Good day, everyone. This is my honor to introduce the International Medical Service of Taiwan University Hospital Yunlin branch for the Taiwan Expo in Indonesia. I am Dr. Pan, the Executive Secretary of the International Medical Center of NTUH Yunlin branch. Today, my topic is the telemedicine service in the countryside. I am very glad to have the opportunity to share my thoughts about teleconsultations in Yunlin with you. There are second part of this topic. First, I introduce how we can do the telemedicine in countryside. Why should we choose this method to solve these current problems? I divide this question in four parts. First, from the hospital-based to ER patient ER consultation. Then the office-based to AR system when the treatment. Then the hospital high dangerous pediatric patient consultation, and the heart screening of children in rural area via teleconsultation. Then the second part is the big issue is the COVID-19 pandemic. They changed a lot of things as a result. Telemedicine start to develop, and online doctors and the pharmacy provide an innovative device and brilliant source of the information. There are some facts about the Yunlin County. Yunlin County is the second oldest country in Taiwan. There are 18.8% of people are over 65 years old. There are also lack of doctors and ward in Yunlin. There are 18 doctors per 10,000 people in Yunlin, and compared to the 30 in 10,000 people in average, almost half of it. There is a saturation of the number of the world, almost 2/3 of the average. Just like the previous slide I hold, because of the high more elderly and high poverty, demand of medical care is higher than other countries. So how to solve this problem? We have the guideline of the WHO 2030 goals. They say that they want to use the high quality and continuums of care across the patient's life course. So we have the 4 dimensions need to consider about these problems. First is the low medical quality and the low medical access. And the third is the low medical quality. And the fourth, we can a lot of the crowdsourcing, those 4 dimensions to solve these problems. So we have the 4 projects to solve this problem for the 4 dimensions. First, we have the Twin Star Regionalization Project to solve the problem of the medical equality. The second, we have the Smart Tailored Care Project to solve the medical access. The third part, we have the High-Risk Neonatal Retrieval Project to solve the medical quality problems. And the final part, we have the crowdsourcing the school children heart screen project to solve the crowdsourcing problems. We can see the photo first of all. We have the conference of the Twin Star Regionalization Project. Even you can see the Minister of the Health and Welfare to come to our hospital to honor our work. Now the second photo, you can see the doctors from both from our part and the Cheng Gung ER department. They can see each other through a screen. So sometimes you have problems, you can consult doctors. If the CT or the MRI problem, we can give you a diagnosis and treatment plan immediately. The third photo is the press conference of the telemedicine project. Now you can see the leader of the NIH also come to our press to commemorate our work. Now you can see the photo 4. We use the microphone to take the picture of the wound. The AI program can calculate the size of the wound and the percentage of the granulation, which may improve the chronic vessel. So the plastic doctors can see the results at our hospital and directly guiding the nurse how to treat the wound. Now you can see the 5th photos. We have the high mortality of dangerous neonatal or newborn patients here because of a lack of experience or the lack of the equipment. Or sometimes lack of the training doctors. So we can provide a doctor. Now, but our doctor needed to see the data from the clinical side. You can see we use the iPad mini. They can transport the data to us. So our doctor can see the condition of the newborn all the way from the clinic to the transportation and to our hospital. Our doctor can take over from here. Now you can see the 6 photos. This is the press conference of a cardiac screening for children with the cloud data analysis. This is the project. Now you can see also the Minister of the Health Welfare come to our hospital again. Now we can see where the doctor showed how to the cloud analysis of the cardiology brain and remotely and shorten the time to report by outsourcing more doctors to join this program. Now the second part is the COVID-19 outbreak after this goal. The projects are continuing to go, and we have a lot of thoughts about the compliance, and we can share to our peers. Because of the quarantine time, it makes doctors and nurses difficult to touch patients under heavily protected clothing. Therefore, we not only provide a wireless monitoring device for each patient, but also provide a wireless digital stereoscope and a wireless pharyngeal microphone to take the image of equipment, prevention and regulations, and decrease the infection rate of caregivers. Now we can see the nice picture. We also have the in-pharmacy window to help the chronic patient who just taking the medicine only during the pandemic period. If you want to ask a question to doctors or pharmacy, some question, you can also use the online doctor app on your mobile phone through online registration without coming to our hospital. Now we can see the final picture. You can see the picture of the pharmacy in the online and a doctor at the picture above. And also the Miss Chang is our country magistrate. They come to our hospital and call the doctor. You can see on the background his medical condition. So above all, is what we can do in to the telemedicine in our countryside. Thank you for your attention. I hope to give you an idea how we can do the telemedicine in the countryside. And thank you very much and goodbye. See you later.
Thank you so much, Dr. Pan, for this wonderful presentation. For the next speaker, we would like to invite Dr. Yao Yu from the Proton and Radiation Therapy Center of Chang Memorial Hospital. He will be introducing to us the Chang Memorial Hospital Proton and Radiation Therapy Center. Please welcome Dr. Wu.
Hi, everyone. It's my honor to be invited by TAITRA to introduce Proton and Radiation Therapy Center in Chang Memorial Hospital. I'm Dr. Yao Yu. Chang Memorial Hospital is the largest and most comprehensive cancer care center in Taiwan. We comprise by a network of 7 hospital branches. And our Proton and Radiation Therapy Cancer Center is opened 6 years ago. It's our first proton therapy center in Taiwan. The Proton Therapy Center have treated more than 3,000 patients to date. And our state-of-art Proton Therapy Center facility can provide cancer patients who need radiation therapy. And today, there are 3 main types of cancer treatment, including surgery, chemotherapy, and radiation therapy. And what is radiation therapy? It's a type of cancer treatment that uses high-dose energy beams to kill cancer cells, and most often use traditional high-dose X-rays. But proton therapy is an emergent trend for treating patients. Proton therapy can be treated as a major treatment, and also before surgery to shrink tumor cells, for surgeon more easily to resect the tumor, and can be treated after surgery to stop the growth of any remaining cancer cells, and also for provide palliative treatment. In summary, over 60% of cancer patients will need radiation therapy. Proton therapy compared with conventional radiation therapy, it can deposit less energy on their way to our tumor and do not damage the surrounding normal tissue. And this property can radically decrease their injury for the normal tissue surrounding our treatment region. So proton therapy can increase the dose to tumor and reduce the dose to normal tissue in terms of reduce the side effects and reduce the possibility of second malignancy. And our proton therapy can treat nearly all types of cancers. And for Chang Memorial Hospital, we mostly treat liver, head, neck, brain, breast, lung, and also pediatric cancers. For liver tumor, if we have a multi-comorbidity status and the patient can tolerate the surgery or the tumor location is too near the large vessels or the size is too large, can be treated by traditional interventional ablation therapy. Proton therapy is a very good choice for patients. We can deliver very high dose X-ray compared with the traditional X-ray, which can be done. And the tumor control rate is very high, nearly 90%. And we can spare normal bowel and normal liver with very excellent local control efficacy. For the head neck cancer, we can spare our oral mucosa, our salivary gland, and our throat. So compared with traditional X-ray, we can decrease our treatment toxicity during treatment in terms of less weight loss or less swallowing dysfunction or less fatigue. And for the long-term toxicity, we can decrease our dry mouth possibility and less dental problems and less muscular fibrosis. And for breast cancer, proton therapy compared with traditional radiation therapy, we can spare our lung surrounding tissue, which means less lung fibrosis. And also the heart is just proximal to our treatment region. We can reduce our radiation dose to our heart. So less heart damage means less cardiovascular event. For pediatric cancer patient is very susceptible to radiation therapy toxicity. So with proton therapy, we can reduce our damage to our normal surrounding, developing, and very young tissue. So we can preserve our neurocognitive function and neural development and normal tissue growth and function, and very important, and we can reduce our second malignancy property. During the treatment, patient can feel better, energetic, and less vomiting, diarrhea, and long-term, patient can have better normal tissue growth and function, and very dramatic lower rate of second malignancy. In our proton therapy center, we have all types of experienced radiation oncology specialties, which means we can provide you very comprehensive proton therapy cancer treatment. And it's very gratifying to see patients with less toxicity and with better quality of life when they get on their work, their school, and the rest of their lives. Thanks for your listening.
Thank you so much, Dr. Wu, for this wonderful presentation. Next, let us welcome Dr. Cheng Gung, the Chief of the Diagnostic Imaging Department from Xinguang Wuhuoshi Memorial Hospital. He will introduce its leading specialties, including orthopedics, neurology and neurosurgery, and health management center.
Kepada yang terhormat Bapak-Bapak, Ibu, teman-teman atau alumni-alumni yang di Indonesia, saya adalah Dr. Cheng Gung dari Memorial Hospital Xinguang. Xinguang di mana? Di Shin, Taipei, Taiwan. Kalau dari airport, Taiwan ke sana 20 atau 40 menit udah sampai di rumah sakit. Jadi kita Xinguang itu udah dimulai di tahun 2001, dimulai jadi medical center. Jadi ada berapa tempat yang nginap, dapatnya 830 bednya. Di bednya itu kalau untuk orang akut ada 543. Kalau untuk unit yang spesial untuk ICU atau dialisis dan lain ada 290. Jadi pengalaman kita kan orang yang admission dari luar, dari patient yang admission itu ada 31.000 orang. Kalau untuk operasi itu ada 19.000 orang. Kalau orang-orang yang berawat kan ke rumah sakit 100.000 lebih. Jadi ke emergency-nya orang yang datang ada 15.000. Udah itu kita juga pikir, kalau kita dari International Healthcare, bagaimana kita menjaga orang. Jadi kita ada tempat yang paling penting, kita adalah TAITRA yang untuk akomodasi lokal. Dua itu koordinasi medicine. Ada kita juga harus translation bahasa-bahasa yang lain. Ada bahasa Indonesia, ada bahasa Miramal, ada bahasa Inggris. Udah itu juga informasi untuk orang yang visa dan pasportnya. Kalau travelnya dan transportationnya kita boleh bantuin juga. Kita kenapa yang kita kemajuan kita rumah sakit kita adalah kardiologi, ada surgery artinya jantung medicine ada jantung operasi. Kedua itu kita juga adalah radiasi terapi atau onkologi. Lebih lagi kita kemajuan kita juga di neurologi dan neurosurgery. Kalau lagi kita tambah lagi robot asisten operasinya. Udah itu ortopedik juga paling maju. Kita kemajuan ortopedik di mana kan kita boleh majuin semi reconstruction dan tangan yang operasi. Kita juga boleh operasinya pakai minimal invasive minimal. Udah itu kita ada spot injury. Udah kita ada tulang yang umum yang dioperasi juga. Lagi kita boleh operasi badannya di belakang tulang. Udah itu kita ada traumatologi ortopedik, ada juga ortopedik untuk kanak-kanak. Udah itu kita akan neurologi kita macam mana kemajuannya. Kemudian kita ada boleh jaga cerebral vascular disease untuk orang stroke. Jadi itu ada endoskopi untuk membantu operasi, ada 3D dimension statik untuk operasi otak. Dari sini kita boleh pikir, bagaimana kita kalau menjaga orang belum terjadi penyakitnya, kita boleh dapat satu yang sister atau center yang menjadinya. Sehingga kita pikir menjadi sesuatu quality yang bagus untuk medical center untuk menjaga orang yang belum terjangkit penyakitnya. Dua, kita harap orang-orang yang belum penyakit kita boleh periksanya pakai alat-alat yang maju. Ketiga, kita harap kalau tiga penyakit yang harus dimajukan dapat sekali diperiksakan. Udah itu kita pikir, macam mana kita menjaganya, kita udah berdiri satu tempat untuk menjaga kesehatannya, kita berdiri di check-up center. Center itu dimulai dari 2004. Udah itu kita pikir, kalau kita ada emergency-nya, efisiensinya kita sangat bagus, 6 jamnya itu boleh diperiksa orang-orangnya dan data-data yang diambil. boleh diperiksain. 3 juga kita kompresif ada intensif untuk orang yang check up-nya. Artinya kalau dia ada abnormalnya, kita boleh panggil spesial dokter yang konsultasi dokter yang lain untuk terus melihat abnormalnya. Juga ada yang pakai suster yang melihat merawatnya orang itu. Udah itu kita udah pikir inilah tempat yang paling bagus untuk orang memeriksa, sangat comfortable-nya untuk teman-teman yang datang periksa. Udah itu kita pikir kalau kita alat-alat kita itu boleh dipikir pakai MRI yang paling maju, sehingga kita masuk tes dalam MRI juga CT scan untuk revolution yang bagus. 3 ada kita masukin molecular PET scan untuk periksa kanker. Udah itu kita pikir kalau kita pakai 3D-nya MRI boleh periksa MRI itu periksa otaknya. Kalau dia ada stroke, kita belum terjadi stroke, kita boleh lihat pembuluh darahnya. Sehingga kita pikir, udah itu kan terjadi penyakit yang akut infection, sebelumnya kita pikir kalau orang itu pembuluh darah di jantung boleh diperiksa atau ada yang sempit, kita boleh cepat melihatnya. Udah itu kita menjadikan corona artery yang periksa pakai angiografi, pakai GE revolusi ini. Udah itu kita pikir kalau orang ada pikir senja belum terjadi atau yang belum dapat, kita boleh PET scan. Sehingga kita waktu tahun 211 kita masukkan molekuler yang bagus PET scan untuk periksa orang-orang yang jadi belum terjadi kanker. Sehingga setahun ada orang yang dari periksa check up itu ada 11.000 orang lebih. Sehingga di sini saya memberikan terima kasih kepada bapak-bapak, ibu-ibu sekali lagi. Kalau ada yang harus kita kontaklah email kita yang di bawah ini, ya emailnya. Terima kasih bapak-bapak.
Thank you so much, Dr. Cheng, for the introduction. Landseed International Hospital advocates a holistic approach in chronic diseases treatment by establishing the Chronic Diseases and CKD Integrated Medical Care Center with patient needs at the macro level to break the boundaries of organs-targeted treatments. Next, let us welcome Dr. Gung, the internal medicine and nephrology consultant from Landseed International Hospital. He will introduce us to the renal replacement therapy in chronic kidney disease, peritoneal dialysis.
Salam sejahtera Bapak-bapak, Ibu-ibu, saudara sekalian. Saya Dr. Teguh Tajeb, spesialis penyakit dalam, penyakit ginjal, dan intensivis dari Landseed International Hospital di distrik Pingchen, kota Taoyuan, sekitar 20 menit berkendaraan dari Bandara Internasional Taoyuan. Rumah sakit Landseed International Hospital merupakan rumah sakit pendidikan yang berjumlah tempat tidur sekitar 630, termasuk 80 tempat tidur untuk hemodialisis. Saat ini kami melayani lebih dari 100 pasien peritoneal dialisis dan merupakan salah satu rumah sakit dengan rasio peritoneal dialisis yang paling tinggi di Taiwan. Saya akan memperkenalkan salah satu terapi pengganti ginjal pada pasien dengan gagal ginjal kronis, yaitu peritoneal dialisis. Pada gagal ginjal kronis terjadi gangguan fungsi ginjal di mana ginjal tidak sanggup membuang sampah metabolisme maupun cairan yang berlebihan, sehingga menimbulkan gejala-gejala seperti uremia dan edema paru. Terapi pengganti ginjal bertujuan utama untuk mengatasi uremi dan cairan yang berlebihan. Ada 3 pilihan terapi pengganti ginjal. Yang pertama, transplantasi ginjal yang merupakan pilihan terapi yang terbaik. Masalahnya, donor ginjal sangat sedikit. Selain itu, hanya dapat dilakukan di pusat transplantasi dan memerlukan obat supresi imun seumur hidup. Sehingga hanya sebagian kecil pasien gagal ginjal kronis yang berkesempatan mendapat terapi transplantasi ginjal. Yang kedua, hemodialisa atau cuci darah. Dan yang ketiga, peritoneal dialisa. Hemodialisa hanya dapat dilakukan di klinik atau rumah sakit yang mempunyai fasilitas mesin hemodialisa. Selain itu, hanya dilaksanakan oleh tenaga profesional dengan menusukkan 2 jarum ke dalam pembuluh darah dan keseluruhan proses berlangsung sekitar 3-5 jam per sesi terapi, 2-3 kali seminggu. Ini merupakan kendala bagi daerah yang kekurangan fasilitas hemodialisa ataupun tempat tinggal yang jauh dari fasilitas hemodialisa, seperti di Indonesia. Peritoneal dialisa dapat menjadi pilihan utama terapi pengganti ginjal pada pasien yang tinggal jauh dari fasilitas hemodialisa atau daerah yang berkekurangan fasilitas hemodialisa seperti di kota-kota kecil di Indonesia. Karena peritoneal dialisa dapat dilakukan secara mandiri di rumah ataupun di mana saja, kapan saja, sesuai dengan jadwal yang ditentukan sendiri, tanpa mengganggu aktivitas sehari-hari dan dengan biaya yang jauh lebih murah dibandingkan dengan hemodialisa. Ada dua jenis terapi peritoneal dialisa, yaitu CAPD, peritoneal dialisa mandiri berkesinambungan, dan APD, peritoneal dialisis otomatis. CAPD atau peritoneal dialisis mandiri berkesinambungan dilakukan secara manual setiap hari dengan memasukkan cairan dialisis ke dalam rongga perut melalui kateter yang sudah diimplantasi ke dalam rongga peritoneum sebelumnya. Kemudian dikeluarkan setelah sekitar 4 jam. Ini dilakukan sehari 3-4 kali. Waktu yang diperlukan sekitar 20 menit per sesi terapi. Sedangkan APD, peritoneal dialisa otomatis, dilakukan di rumah sehari sekali saja, pada malam hari sewaktu tidur dengan memakai mesin khusus secara otomatis. Data-data terapi dapat dikirim secara otomatis melalui internet ke pusat dialisis atau dokter ataupun paramedis untuk memudahkan pemantauan terapi dan penyesuaian dosis. Selain itu, Landseed International Hospital juga melayani konsultasi jarak jauh secara online melalui telemedicine. Kami merupakan rumah sakit di Taiwan Utara yang pertama disetujui oleh otoritas Taiwan untuk pelayanan telemedicine. Sejak Oktober 2020, kami telah menuntaskan lebih dari 600 kasus dengan konsultasi melalui telemedicine. Demikian sekilas info mengenai terapi pengganti ginjal peritoneal dialisis dan telemedicine. Semoga bermanfaat bagi bapak-bapak, ibu-ibu, dan saudara sekalian. Untuk informasi lebih lanjut, dapat menghubungi saya di Landseed International Hospital, bagian nefrologi atau ICU. Terima kasih atas perhatian Anda. Salam sejahtera.
Thank you very much, Dr. Gung. Moving on, we would like to invite Ms. Miranda Lin, the project manager of Changhua Christian Hospital Overseas Medical Mission Center. Changhua Christian Hospital built the first green and smart hospital in Taiwan. Miranda will introduce the Changhua Christian Hospital for us. Please welcome Miranda.
Ladies and gentlemen, thank you for being here. I'm Miranda, the project manager of Changhua Christian Hospital Overseas Medical Mission Center. Today, I would like to give you a brief overview of featured items in Changhua Christian Hospital. Changhua Christian Hospital was founded in 1896. It's now the most historical medical center in central Taiwan, having more than 4,000 ward beds serving in 9 branches and cooperative hospitals. The services cover Changhua, Nantou, and Yunlin areas. In 2005, Changhua Christian Hospital built the first green and smart hospital in Taiwan, transforming traditional hospital workflow and providing superior medical care. Changhua Christian Hospital officially launched the overseas medical service and missionary with a core value of share, which includes the meaning of spiritual, health, alliance, resource, and education. Over the years, we've left our footprint throughout Africa, Asia, South Pacific, and Caribbean regions. Changhua Christian Hospital has been awarded lots of national and international accreditation, such as CCPC, TUV, CAP, AHARP, for CAP, SNQ to deliver high-quality, affordable, and accessible health care. Yunlin Christian Hospital is a branch of the Changhua Christian Hospital. It's green, clean, and the first innovative hospital in Taiwan. The building design was awarded Gold Honors in 2015 under the U.S. Green Building Council's LEED rating system. In pandemic time, we placed a higher standard on infection control. Therefore, epidemic prevention robots, multifunctional automatic disinfectant arch, and biokill bacteria elimination technology are all applied in our hospital. Yunlin Christian Hospital provides professional knowledge and technology in smart healthcare design, construction, and management consultation. Besides, several groups come to Yunlin Christian Hospital for the study tour and professional training every year. Advanced health examination and management is one of our feature items that recognized by Commonwealth magazine by 2017. In CCH Health Management Center, the medical imaging examination and palace endoscopy areas are for health checkups only. We introduced 1152 slice CT scanner and 3T MRI scanners from Siemens Healthineers, enhancing diagnosis treatment planning by providing more accurate imaging. Besides, we offer various types of checkups and services adapted to every patient's needs. When we talk about reproductive medicine, you should take a look at CCH Reproductive Medicine Center. As one of Taiwan's leading reproductive medicine centers, our IVF center was granted with symbol of national quality and accredited by CAP. There's an overall 50% IVF success ratio in our hospital, and the genetic medicine department provides new prenatal screening to determine whether a fetus has certain genetic disorder before birth. To improve the quality of medical treatment, we've created a people-oriented non-toxic environment. In 2020, the center also awarded WELL certification at the gold level. Da Vinci surgical system is another feature item in Changhua Christian Hospital. Robotic surgeries allow the surgeon to perform a complex procedure in a tiny space with more precision, flexibility, and control than is possible with conventional techniques. Until now, it's performed on breast cancer, gynecological cancer, gastrointestinal cancer, urologic cancer, organ transplantation, etc. Changhua Christian Hospital has been carrying out overseas medical staff training to strengthen the clinical skills and professional knowledge of healthcare for over 10 years. The training program is designed for medical professionals. Since the outbreak of the COVID-19 pandemic, the training was all transformed into online courses to continue providing the knowledge and case study for the medical staff who is eager to improve medical care. Our online courses cover a wide range of categories. We will issue the e-certificate if you finish viewing all videos and pass the post-examinations. Besides, you will have an opportunity to come to our hospital for clinical training in the future. Telemedicine is a trend in the coming year. Changhua Christian Hospital also provides international patients with professional health consultations. Through phone or video with specialists, patients can get an expert second medical opinion in their community or home without geography or location restrictions. If you need to make an appointment for telemedicine, don't hesitate to get in touch with the CCH Overseas Medical Mission Center for relevant information. Our executive officer will respond timely to your request or concerns or arrange a video chat with a doctor. These are feature items that we want to show you today. We keep providing high-quality care and focusing on improving patient satisfaction and experience. Thanks for your time. We look forward to working with you.
Thank you, Miranda. Next, let us welcome Dr. Li Jianjian, the director of the International Medical Center from National Cheng Gung University Hospital, to explain its collaboration in medical and healthcare program. Please welcome Dr. Jian.
Hello, everybody. I'm Dr. Cheng. I'm the director of International Medical Center in National Cheng Gung University Hospital. Welcome to Indonesia Taiwan Expo. It's my great pleasure to give you a brief of my hospital. National Cheng Gung University Hospital is situated in Tainan City, Taiwan, and we have a branch hospital around 70 miles away from Tainan City. Since NCKH is a university hospital, The history can be traced back to 1931, when the school was first established as an engineering college. In 1956, the school system had transformed into a university system, and we have the name of Cheng Gung. It means succeed. Our hospital was officially opened to the public in 1988. After 5 years, we have the College of Medicine. There are around 5,000 staff in our hospital, and over 60% are doctors and nurses. We have around 1,200 beds, and around 70% are acute beds. Here we can see the map of NCKUH, the medical center, and we have two main buildings connected with the Sky Bridge, and next to the inpatient building is the College of Medicine. As the only national university affiliated hospital in southern Taiwan, NCKUH is charged with the goal of improving the standard of medical service in southern Taiwan to reduce the discrepancy in medical services between north and southern Taiwan. With the core value of life, love, excellence, and creativity, the hospital not only provide educational and research services to the medical personnel, but we also provide comprehensive and heartwarming medical service to the public. We provide not only high quality emergency, inpatient, outpatient health examination services, but also we provide the tertiary care for the emergent, critical, complicated, and rare disease to the public. Now I'm talking about the highlight of our hospital. We are not only have edge-cutting medical devices such as the Da Vinci surgical system, hybrid or PET-CT, 256 CAT scan, and so on. There are multiple disciplinary teams to provide comprehensive care such as transplantation care, ART, stroke team, diabetes prevention center, Alzheimer's disease prevention center, and so on. We also devoted ourselves into the trend field like precision medicine, gene medicine, e-health, cell therapy, modern fetal medicine, nanomedicine, and AI for the high quality medical care and health promotion. What I want to mention is the transplantation. In our hospital, we have our own organ bank, and we can do the ABO incompatible transplantation, and with liver transplantation. And we have the best survival rate on the heart transplantation in Taiwan. Our percutaneous intervention, we made a world record on extremely low birth weight baby, which is only for 78 grams in 2017 and without any brain insult. As we know, Taiwan had officially been an aging society in 2018. But early in 1999, we had the first elderly-friendly ward in Taiwan, and now we are building also the first geriatric hospital in Taiwan, and you will be done in 2022. As a medical center, NCKUH upholds social responsibility. We conducted international collaboration program early from 2008, and now we have a link with Kenya, India, Vietnam, Indonesia, and some other Southeast Asian nations by co-hosting international conference, joint research, and personnel exchange. Moreover, NCKU have 3 overseas hubs in Vietnam, Malaysia, and Thailand to promote the network with overseas enterprises, governments, and academic institutes. The Department of Nursing, NCKU College of Medicine, which has been established in 1989, and Open International Advanced Program in Nursing, we call it IAPN in 2012, and International Doctoral Program in Nursing, IDPN in 2017. We have cultivated many talent in nursing, and they all reach great achievement when they go back to their home country, especially Indonesia. We have strong links with top universities like University Erlangga, University of Muhammadiyah, University Gajah Mada, and Stipkem Pebeni, Jawa Barat. We are knowing that cultivating talent is one of the key to enhance the competitiveness, and we believe the links are very helpful and strengthening the partnership, and we benefit for all both sides. And thanks for you.
Thank you so much, Dr. Jian. Next, Hualien Tzu Hospital will introduce one of the latest heart surgery techniques. This kind of transcatheter aortic valve replacement greatly shortens the operation time with fewer bleeding problems, and the patient recovers faster. Let's take a look together.
爸，一起来啊！子轩要丢哪里？你要放到哪里啊？哇哦，你在帮他浇水是不是？好棒哦！爸，爸你怎么了？爸你怎么了？
陈先生，这是你爸爸他的主动脉瓣的这个影像哈。父亲因为昏倒，然后到急诊，那我们检查发现他这个主动瓣膜硬化、钙化的非常厉害，他没有办法打开，这个瓣膜已经没有办法使用。那所以这个情况之下，一般传统上需要开心手术。
医师，这个开刀的风险高吗？
传统上来说，我们不管是所谓的微创手术，我们必须要接上人工心肺机，让心脏停下来。可是人工心肺机会产生一些发炎反应，或者是造成病人后续的一些肺炎啊，然后肾衰竭啊等等这种并发症。那我们今天所做的这个叫经皮的主动脉瓣膜的置换。那这种经导管的瓣膜置换，那病人他就不需要接上这样人工心肺机，手术时间也大幅的缩短，比较没有出血的问题，所以这样的病人他会恢复比较快。
因为有这个所谓的复合式的手术的平台，那使得我们心脏内科跟外科医师可以在这个平台上各发我们的这个专长，那让内外科医师可以在这个平台一起帮病人完成这个复杂的手术。
我们在这样复合手术室里面，我们可以用这种高阶的 X 光，然后我们有一个好的定位，所以我们就可以在整个在 X 光下操作的情况，那我们就可以去做这个瓣膜置换，而病人就不需要再接受开胸。
以前需要动好10几个小时的很复杂的心脏外科手术，现在可以在复合室里面，心脏内外科医师呢，可以在很短的1个多小时，利用新的科技跟新的材料，就可以把病人的问题解决。
这种混合型的手术是以病人为中心，对病人有需要又要开刀又要血管摄影这样子的一个病患是最大的福音。
嗨，
张医师，
嗨，阿伯。我小甲你听者好不好？
好，感恩。
你啦，即马心脏拢无杂音，加盖好呢。
太恭喜哦！你像摩尔瓦新的啦，也在用盖固。
在一个区域的医疗中心，我想全世界都一样，它有一个很重要的责任，它要把最新的医疗还继续的要跟得上最新的医疗，还要把新的医疗往前推，然后让病人呢可以用最安全的方式。可以获得最好的一个结果。
病患除了在照顾、在救命，我们讲说心跳不跳，让心脏可以跳。那心脏要预防它不能不跳，但是在这个过程中，往往病人最担心的是在治疗当中是不是会身体不舒服，使他们产生了恐惧。那佛陀说医病不是只有医病，还要医心，所以在照顾病人救命当中，也利用这个高科技的方式，我们现在不但是只有救命救心，还可以帮助让他们在这个过程中可以更舒适。
在过去这几十年来，我们一直努力的用创新研发的方式，我们也希望这个医院呢是追随着我们上人慈善的脚步，我们也希望能够救援到99国，那可以救更多的生命，不断的在品质提升，不断的在培育人才，而且是一个充满着爱心的一个医院。
Thank you to Hualien Tzu Chi Hospital for this wonderful video presentation. Moving on to the second session, where the main topic is smart healthcare. Now we will introduce the popular Wonki Quantum Beat series and Meridian Ring series. Wonki extracts biomessages from Chinese medicines and then uses nanoparticle coupling technology to install energy into glass beads and rings. Let's watch this video together.
I can finally stop drinking Chinese medicine, and my menstrual pain and constipation are relieved. After using Wonki Quantum Biotech series for months, 35-year-old Sally excitedly shared that she can get rid of discomfort. Wonki Biotech is a professional team built of Chinese doctors, medical equipment vendors, and healthcare professionals. Over the course of thousands of hours research and development, and proven by the world's unique scientific meridian instrument, it balances the 12 meridians and easily wakes your self-healing abilities. Wonki extracts biomessages from Chinese medicines and then uses nanoparticle coupling technology to install energy into glass beads and rings. When drinking water or wearing the rings in your daily life, you will be wirelessly filled with energy to reach the best conditioning of your body. It's not only easy to use on a daily basis, but also possesses a super high value. Wonki helps your body to maintain balance through its health management system. Wonki, the most pure and primitive energy from nature, sincerely guarding the health for you and your family.
Next, we want to introduce another excellent product. Insight Medical Solutions developed the world's first magnetically controlled capsule endoscope capable of completely examining the upper digestive tract, EGD, that is easy to use, painless, free of anesthesia and cross-infection, a new choice compared to traditional endoscopy. Let us welcome Ms. Wendy Ko.
Insight Medical Solutions Inc. is founded in 2015, specialized upper GI tract endoscope. Our products successfully launched in Taiwan market in 2019. Today, I'd like to introduce you this novel medical device. Have you ever had terrible experience of upper GI tract examination or heard anyone suffering from the examination process? Let me give you a new idea of the upper GI tract examination. As the first generation of the capsule endoscope is launched to the market in 2001, it's highly improved on its examination process, especially in user experience. However, it could not be controlled. Seeing this clinical unmet need, Insight Medical Solutions dedicated to develop a better examination experience on upper GI tract endoscopy. The second generation of the endoscope, which is able to control by the magnetic and the wired. Most important is that the wire is made of the Kevlar fiber, which is the high-strength material and known for being used in parachute. The pros for the wired endoscopy is we could position it linearly, then manipulate it with the magnetic field navigator. MFN, to control the endoscope in 3 dimensions. Inside ICGD system includes the main machine, dongle, the connector between the computer and the endoscopy, MFN, the magnetic provider to control the endoscopy. We could operate the MFN forward, backward, and rotate. Even tilting and rotating, we could do that together. The picture shows how the doctor operates the MFN. You might be still wondering how it works. Let's watch the short video.
The scope of the inspection includes various parts of the upper digestive tract, such as esophagus, stomach, and duodenum. Due to faster gastrointestinal motility, wired devices can go back and forth to observe symptoms. The patient is fully awake during the process. Through medical-grade displays, the patient can review the gastrointestinal tract in the body and have a full discussion with the physician.
These are the actual photos and examination environments in Zhongshan Hospital Capsule Endoscopy Center in Taiwan. We have already qualified by TFDA, GMP, ISO 13485, and we are very honored to announce that we have got the approval this April. Not only focus on regulatory compliance, as a technology-based companies, we also put IP strategy into consideration, like Taiwan, China, Europe, and the USA. What's more, we conduct the clinical trials in very beginning to verify the efficacy and safety, and conducting the clinical trial for tracing product post-market surveillance. In the beginning of this year, we conduct the clinical trial with the most authoritative hospital, National Taiwan University Hospital, for further investigating of the endoscope. For these clinical trial results, physicians also successfully published in Surgical Endoscopy Journal, and more clinical results are under reviewing. Let me rate 3 key features that we really like to emphasize on: safe, comfort, and rapport. Safe, the system provides a high accuracy diagnostic function. According to the clinical trial conducted in Majie Memorial Hospital, the completeness of the diagnosis is almost 100%. The endoscope is sterilized, no anesthesia is required, therefore it is no cross-infection concerns. Most important is the COVID-19 pandemic. The aerosol generating procedure raises possibility infection rate for medical personnel. Inside CGD system could effectively avoid the infection percentage. Comfort, on patient side, they could swallow the endoscope easily and no pain would occur. Moreover, patients don't have to ask their family member for accompany during the examination, because anesthesia is not required. They could resume the normal life right after examination. On medical personnel side, physicians could operate the endoscope by simple gesture. For example, they could operate the MFN by forward, backward, rotate, tilting gesture, then control the direction of the capsule endoscope. The doctor advantage is medical personnel doesn't have to spend time on routine sterilized process. Rapport. Inside ICGD system could provide the accurate real-time image. Patient could smoothly communicate with the doctor during the examination, which could provide a positive doctor-patient interaction. The light inside ICGD system is easy for carrying, so it is able to move to any ideal medical place, which could minimize the distance if the patient has a difficulty in moving. Our vision is to develop more safety and effective medical equipment to promote the social welfare and national health. Inside ICGD, system realizes the anesthesia-free, painless, disposable, and cross-infection-free for upper GI endoscopy. The system also provides a better option for patients who is fearful of the conventional endoscope examination and highly avoid the risk of anesthesia and post-operative complications. That brings the high acceptance. We believe that the system could provide early diagnosis and early treatment for the various common diseases of the upper GI tract. That brings me to the end of the presentation. Thank you.
Thank you, Ms. Ko, for this wonderful presentation. MBI's biomedical products are mainly applied to the usage of orthopedics, orthotic medicine, dental, and ophthalmology. The production quality is in accordance with international regulations and requirements. Their products have been certified by Southeast Asia markets. Let's take a look together.
Maxigen Biotech Incorporated. MBI, Make Better Life. MBI is located in Taiwan. Our headquarters is in Taoyuan, and the skincare manufacturer is in Tainan. We have two major departments, Biomedical Department and Skincare Department. Collagen, bioceramic and hyaluronic acid are the three major medical materials in Biomedical Department. Hyaluronic acid. There are three product lines which are intra-articular injection, OVD and dermal filler injection. Intra-articular injection, made of hyaluronic acid, can be directly injected into the painful and inflamed joint cavities for the treatment of osteoarthritis. We have three different dosages of intra-articular injection: 1 dose, 3 dose, and 5 dose. RD Best is 1 dose cross-linked product. RD8 Plus is 3 dose and RD8 is 5 dose. Ophthalmic viscoelastic OVD can be used in cataract surgery to protect the corneal endothelium during the replacement of intraocular lens. There are 3 products in OVD product line: cohesive, dispersive and ophthalmic viscoelastic system. Viscate is the cohesive OVD, Previscate is the dispersive OVD, and BiVisc is the ophthalmic viscoelastic system. Dermal filler injection can be injected beneath the skin to restore the tissue volume, enrich the shape, and contour the facial features. We have 5 dermal filler products, based on different particle sizes. Each product is uniquely formulated to have a certain texture, density, and injection depth. Synthetic bone graft can be used to fill bony defects which might be surgically created voids or defects from traumatic injury to the bone in non-weight-bearing area. We have 3 calcium phosphate ceramic bone materials and 3 synthetic bone material products made with collagen. There are completed product lines in artificial bone materials. Each product has different characteristics, and the most suitable product can be selected according to different needs. The collagen-based regenerative matrix has porous structure and inherent characteristics of natural collagen. There are different types and specifications according to different surgical procedures. There are 3 products for collagen-based regenerative matrix: guided tissue regeneration membrane and wound dressing. We have collagen-based regenerative matrix that can be used for dental and surgical wounds. MBI's products are sold all over the world, the sales continues expanding, and all the products are made in Taiwan. We have obtained many certificates in quality. Our mission is to provide the best quality and services to our customers. Thanks for watching. If you have any interests of our products, please contact us.
Thanks for watching. Moving on, we have Mr. William Su, the Product Managing Director from Orange Plus, to introduce their live proposals to seniors and mature people. Please welcome William.
Hello everyone, I'm William Su. I'm the Product Managing Director from Orange Living. Today, I'm delighted to represent my company to introduce our brand, Orange Plus. The aging era has arrived over the past decades. We discovered the solution for elderly and healthcare is the most obvious needs for futures, but people tend to stay in their comfort zone, so that's why Orange Plus was born. Besides fulfilling the needs of elderly and the following generations, improving the aging process for seniors and also help younger disabled people by developing new functional health products. We pursue experience in design for making everyone pursue a more realized life with better quality. Orange Plus covers the surrounding of seniors, what could help them living with more convenience and have a pleasure living. Orange Plus provides solution of how to achieve home living pleasure. we propose some collection which could satisfy seniors' needs in daily life. Next year, we launch our first collection, Bon Voyage collection. The first challenge of the senior is usually they have difficult emotions. Bon Voyage collection combines three major intentions. Our product will offer service on mobility, stability, and independence. I will later present our first three products under this collection. Rock Steady Can, that we call RSC. This is the new image of can. What we want to achieve is that the can provides not only great stability, but it also looks like furniture at your house. Using the RSC like a conventional can, pick it up and move with each step. For more speed, using in rocking motion to get great stability. Using two cans for greater stability, one in each hand, much faster than using a walker or using it like a walker in front of you. The RSC help you get in and out of vehicle, out of chair, out of bed, or of the toilet. It was designed to help you achieve mobility and stability in a light way. Easy to use design that is very strong and supports up to 300 pounds. The versatile can flow out easily for storage or for use on the go and can even be stored in the front seat of a car. Stair Assist Can, that we call SAC, is an innovative creation which supports you from getting upstairs and downstairs, and it also helps you save a huge budget on the stair lift. The SAC possesses 4 contact points, which stands on 2 staircases, increasing more stability. Each tube provides 12 levels to adjust. The compact design works well on most stairs. This is the first can in Taiwan, which stands stably on 2 staircases at the same time, with 4 contact points, and 2 handles work for up and downstairs. The SAC is your best body moving up and down. Rock Steady 6000, that we call RX 6000, is not just for walking. The RX 6000 saves your time on sport. Instead, it helps you get good performance on workout. There's one suggestion: work 10,000 keeps you healthy, but actually, you don't really have to work that much. With the aid of RX 6000, strengthen your spine and exercise your upper body. The RX 6000 is twice thicker than general pro walking sticks, and with anti-slip rubber base. The can tip is made of strong non-slip rubber to increase traction and the stability, suitable for all kinds of surface. The RX 6000 commonly can be used for walking or hiking, and it withstands enough pressure to support your body weight from getting up and even doing simple workout, for instance doing squat or lunge. We have created the product roadmap. If you are interested to be one of our distributors in the Southeastern Asia, please do not hesitate to contact us. We are very looking forward to our future partnership. We are the Orange Plus team. Thank you for your attention and wish you have a good day.
Thank you so much for this wonderful presentation. Ladies and gentlemen, this concludes our webinar today. Thank you for joining us. If you have any questions or wish to negotiate with the listed companies, please scan the QR code immediately and leave your contact information. In addition, Taiwan Expo in Indonesia is also open for buyers to visit today. We welcome everyone to scan the QR code to visit online. Please remember to come to Taiwan Healthcare Pavilion to find us. We're looking forward to communicating with you online. Thank you again for watching, and we wish you every success in your future endeavors.